Hi, I'm Chris DeBow with the Canadian Arthritis Patient Alliance here at the CRA 2014 scientific meeting with CRA President Carter Thorne. May I call you Carter?
Absolutely.
I'm here with Carter Thorne, President of the CRA. Welcome, Carter. Thank you for taking the time.
Thanks very much, Chris.
All right. We've been asking people in our interviews, can you tell us something interesting and exciting that's come out of the CRA this year? And a few people have mentioned choosing wisely, and I know that that's something that you're obviously quite involved with, and I'm wondering if you could tell us a bit about choosing wisely and what it hopes to accomplish.
Yeah, choosing wisely is about looking at our practices, and specifically in this instance, the practice of rheumatology. We're not here to point fingers at anyone else except ourselves. And reflecting on what it is we do as much as possible, if we can, using evidence to guide us. And in that regard, we went through a process with our members, and we had a significant cooperation with our members, collaboration. Put together a team of individuals. This was led by Dr. Shirley Chow at Sunnybrook Hospital in Toronto, and then she put together two different groups. Well, one was a research committee, and the other was the steering committee, and then of course involved all the membership through surveys. And we looked at and suggested different topics and themes that we could do to improve the way we practice medicine. Medicine often is like an accumulation of things. It's like putting stuff in the attic and never getting rid of it, or filling the garage up. Yeah. And every once in a while you got to clean house a bit. And it's looking at the practices that we have and saying what do we not need to do? Right. And because that costs money. Something may only cost $10 a test, but if you do 2,000 a day, every day, that's a lot, or whatever. It also places a burden on patients. Indeed, yeah. So what we did is we went through an iteration, and through the first go through, we found about 80 different themes and topics, and then we went through what's called a Delphi process. And then we whittled that down to five different themes or topics. And in that we included diagnostic tests, so we included therapeutics and such things as that. This is part of a larger initiative. It started in the US by the American Board of Medicine, and was brought to Canada by the Canadian Medical Association. So there's about 40 specialties in medicine surgery in Canada, and we're in the first wave of 8 that have taken the torch. That includes family practice. And we have done it in a very robust, evidence-based fashion. And uniquely, as you know, Chris, because we called upon yourself and some of your colleagues, to look at those things, the choices, and to work with a dissemination process. Because it's not just identifying, it's disseminating. Right. And it's not only disseminating to my members about what they should and shouldn't do, but they're oftentimes responding to requests from the patient population. Should not be having this test or that test. Right. So there's going to be dissemination that you're going to be involved with, as well as Don Richards, another member of your collaboration. Yes. And we're going to be working with the Consumers Reporting. Again, an independent organization, and you're going to help them develop the lay language that means something to people who have arthritis, so they can relate to it. That's right. And so the idea is that you get this information about, I don't know if you want to call it best practices or a list of guidelines, and it gets into the hands of both physicians and patients. So that there's information flowing on both sides. So this is part of a larger picture that we're trying to do as a professional organization, which is to identify best practice, to identify quality indicators. How can we know each of us, one at a time, how we're doing? We're only going to know that by having the ability to place that mirror in front of ourselves. And sometimes that mirror is more difficult to place, but when we develop these quality indicators based on evidence that we can then use later on to do our practice audits, that'll make us all better physicians and better providers of care to people who have arthritis. Well, thank you very much. Thanks, Chris.